Um, Good morning, good afternoon. We're really honored to meet with members of MedGlobal Gaza, MedGlobal Palestine team. I think over the past 8 months or so, everyone knows now that this crisis, this war in Gaza, has been horrible on the population. The impact of war on civilians, on hospitals, on healthcare, on children, on women, on elderly, on patients has been catastrophic. The healthcare system has been decimated. Um, More than 40,000 people have been killed. More than 90,000 have been injured. About 5% of the population in Gaza have been either killed or injured. This is the equivalent of 15 million Americans killed or injured within a matter of 8 months. And the impact on schools, on universities, on infrastructure has been horrible. So we would like today to highlight some of the success stories. MedGlobal is an organization that tries to improve access to healthcare in disaster areas. Over the past 7 years or so since our inceptions, we worked in more than 25 countries. We've been in Gaza since 2019. We started by sending medical missions. We call it resiliency medical missions focused on training. And with time, we grew. We established a team on the ground of local Palestinian doctors and nurses and humanitarians. We are registered in Gaza. We are part of what's called the health cluster. That means we coordinate with UN agencies, with international NGOs, with hospitals, with local hospitals and health authorities to make sure that a patient can get their medicine, a doctor can get their supplies and medical technology and training. A midwife can help get their training, and nurses also can get their training and support. And we believe also on advocating on behalf of the population that we serve. Um, Over the past 5 years or so, we established multiple sustainable healthcare programs. Sometimes there is this perception that MediGlobal and other NGOs establish medical programs or conduct its business by sending doctors and surgeons from the US or other countries to Gaza or other places. This is very small part of what we do. Less than 5% of the healthcare programs are done by medical volunteers who travel from the US or UK or other places to Gaza and other countries. But 95% of the work is done by local doctors and nurses who are serving their communities in Gaza and other places. So today we're going to be focusing on these heroes, unknown heroes, because you don't see them in the news, you don't see them on social media, but they are the ones who day after day sacrifice. They are themselves, many of them are displaced, many of them lost family members, many of them lost their houses, many of them live in tents, even in displacement shelters, but they go to the hospitals, to the clinics to serve their communities. So with us today are several members of our team, that some of it is in Gaza and some of the team, of course, in the neighboring countries to support the operations in Gaza. As everyone knows, um, getting into Gaza is very complicated. So you need to have support team in Egypt, you need to have support team in Jordan and other places. So with us today are Dr. Rana Sobh, Dr. Muhammad El Dikruri, and Jackson Diconici, Diconicini. So let's start with Raja. Raja, can you introduce yourself, and then Rana, and then Dr. El Dikruri, then Jackson? You are muted, Raja. You are muted. Okay, now.
Yeah, hi everyone. This is Raja Masleh, the country representative for MedGlobal Gaza. I'm located now in Egypt, Cairo. Thank you.
Thank you, Raja. Rana, introduce yourself. Where are you located, and what's your position within our team in Gaza?
Hi everyone, how are you? I'm Rana Subuh. I work as a nutrition officer in MedGlobal in North Gaza. Actually, I'm in Gaza City, and work as a nutrition officer again. Thank you for all.
Thank you. Dr. Al-Dakruri.
Hello, everyone. This is Dr. Mohammed Dakruri. I am the emergency medical team coordinator that coordinates the entry of emergency medical teams to work in Gaza. And I'm currently working in Cairo, in Egypt. And I'm pleased to meet you all.
And Jackson.
Hi, I'm Jackson Becancini. I'm the Programs and Partnership Officer for MedGlobal in Egypt, but I've also gone into Gaza to support our medical missions in the past.
And we are joined by Dr. Hussam Abu Safiya, my dear friend. Dr. Hussam, you want to introduce yourself and where are you right now and what's your position? You're muted.
I am Dr. Hussam Abu Safiya, the director of Kamal Adwan Hospitals. Our hospital is located in the north of Gaza. Welcome, everyone.
So, Raja, you've been in this position of helping and serving the community in Gaza, leading MedGlobal team since we started. You witnessed the ups and downs, what we have done in the past, what we have done, and your team basically have done since the beginning of this war. So describe to us the evolution of MedGlobal work, how we started, very small effort, how we grew, and what we are doing right now in response to the war. And you are muted. If you can unmute yourself.
Sorry for that. Actually, if I want to speak about MediGlobal, I'm all the time speak that I'm consider MediGlobal as my baby. And my baby start like small baby, and by the time it's grow now and become bigger. We start by small projects, and after that, after a huge work and support from headquarter, of course, we start to grow, and our programs start to be bigger and bigger. Now we have many programs at Gaza City, and I have a very unique and a big program, which is a nutrition program. Actually, during this war, this program really serve a huge number of children under 5 suffering from malnutrition. We now have 3 stabilization centers. This stabilization center distributed all over Gaza Strip, starting from south, and we have one at the Gaza Strip, Gaza City itself, and one at the north area. This stabilization center actually admits or receive patients suffering from, or children under 5 suffering from severe malnutrition with complication. Maybe Dr. Hussam and Rana will speak about that issue. Until the moment, we screened over 10,000 children under 5 all over Gaza Strip. And this is really, it is a unique issue. And during suffering of no access for food, no medication, no food for children or milk, this projects actually help a huge number of children. In addition of that, we have primary healthcare center serve around 500 cases during the day, and we have until the moment 15 medical points distributed all over Gaza Strip. We serve daily around 3,000 patients or IDF through our medical missions or medical points in Gaza. So our programs start to be bigger and bigger, and we targeted more and more beneficiaries all over Gaza Strip. Now, maybe I will give the mic for Dr. Hussam to speak more about the nutrition programs that we have, especially in the north area. The mic is yours, Dr. Hussam.
Yes, but I want to highlight something that you've mentioned, that
Yeah.
every day our team in Gaza is serving about 3,000 patients every day in the
Yeah.
15 medical points, in the 3 stabilization centers. How many doctors, nurses who are from the local community in Gaza who are serving their community in our medical points?
Actually, until the moment, we have more than 200 healthcare providers deliver care for the IDPs all over Gaza Strip. And actually, during the upcoming days, maybe I have a call after this meeting from the WHO, and they mentioned that they will support us by a new primary healthcare center. We'll establish this primary healthcare center at Gaza City. This is new news. I'm just received a call from WHO, and they will set up a meeting. I will invite you, by the way, Dr. Zahir, to attend our meeting at Saturday to discuss this project, and also they request our support for the polio situation in Gaza. They want to, from MedGlobal, to support us. One of the colleagues from the WHO said that this is Raja, this is your fault. You said that, or you mention all the time for WHO, you are heroes. Because of that, WHO all the time contact you. Raja, hi, we need your support. So for my team, be ready for another task in Gaza City, Rana. Just be ready for that.
So 200 people, 200 doctors, nurses, and humanitarians like Dr. Hussam
Yeah.
and Rana and Amir and Shafiq are running our programs in Gaza. They are serving their communities. So for people who ask, how do you serve people if you're not able to send them from the United States? We can tell them that the people in Gaza are served by doctors and nurses in Gaza. And that's our model in MediGlobal. And this is called localizations or partnership with local communities.
Yes.
MediGlobal Gaza is serving the people in Gaza. Dr. Hussam is one of our dear friends and essential parts of the team. He witnessed the ups and downs over the past 9 months or so. At one point, his hospital was under siege. Part of it was destroyed. His house was destroyed. His son was injured. He's one of those heroes that you don't see them that much on the news. And I want to highlight his contribution and the essential part that Kamal Adwan Hospital in north of Gaza in Beit Lahia is playing right now after about maybe 20 hospitals that went out of business in Gaza because of the destruction. Today, I was looking at some of the report that our team has shared, Shafiq has shared, the number of attacks on healthcare in Gaza. And there are about 500 of them that led to the killing of about 747 people inside hospitals and clinics and ambulances, and injuring more than 900. 20 hospitals were out of service because of these attacks. So, Dr. Hussam, tell us about what you have witnessed over the past 8 months and what you are doing right now to help the populations in northern Gaza through Kamal Adwan Hospital.
Thank you, Dr. Zahir. ما شاء الله عليك. طبعا يعني we welcome you to Kamal Adwan Hospitals. I would like to show you around our hospitals. Kamal Adwan Hospitals is located in the northern Gaza Strip. Before the war, our hospitals provided services for pediatrics department as the ER and general ward, pediatric ICU and neonatal ICU, and obstetric and gynecology. When the wars began, Kamal Adwan hospitals become the main hospitals who receive all cases, wounded cases, injured cases, with specialists that did not exist in our hospital. So we created departments within our hospital, such as neurosurgery, vascular surgery, general surgery, and we treated a lot of numbers of wounded and injured people and saved many lives, most of them children and women. Also we a dialysis department we also opened in Kamal Adwan hospitals after destructions of dialysis building named Noor Kabi in the near the Indonesia hospital. So we still actually still we have a great challenges that we need to overcome. For example, there is a spread of the epidemic now in our area especially in polio viruses now. And we have a lot of cases of gastroenteritis. We have a lot of cases of hepatitis A. We have a lot of cases with hepatitis A with complications, as well as we have a big problem in the sewage now. Our sewage in the street. Uh, uh, this is a high risk to spread of the infections in the our shelters. We don't have clean water and we don't have clear food. So all children, we received about 300, 500 babies every one day, every 24 hours. So it is a big challenge actually, because we don't have enough medical supplies and some medications. So the MedGlobal was of the first to provide malnutrition treatment service by training volunteers staff in our hospitals. We prepare some centers. Some centers, it means severe acute malnutrition with complications. We examined about more than 2,000 babies. 500 of them from 6 to 5 years who were considered severe malnutrition baby.
It's heartbreaking what you're describing, Dr. Hussam, and I'm really humbled to speak with someone like you and with Rana and Raja, who are in the forefront of helping the people in Gaza. And I cannot imagine what you went through. But you continue to work day after day with a smile, with a humility, with determination. And this is what is the meaning of people in Gaza. If you ask me, what's the definition of resilience? I'll tell them, look at Gaza. Rana, you joined our team recently. You are responsible for the nutrition. Tell us a little bit about your work and what do we do in the stabilization centers. And I think everyone now know that there is famine in Gaza, that people don't have access to nutritious food. I saw one of your videos today. You're talking about the fact that there's no access to good food, fruits, vegetables, poultry, meat, and you only have access to canned food and carbohydrates, carbs, bread, and stuff. So tell us about your life and how can we serve the people if you don't have access to food? How can you get nutrition to children with malnutrition?
Okay, actually, here in North Gaza, the situation was very difficult. No, as you seen and you hear, no food, no vegetables, or no fish, and anything that support the body. We have just canned foods and some flour available, and all of this lead malnutrition among both children and mothers. Also, unclean water that cause skin disease. And now MedGlobal should to enter the social and solve its problem. Actually, we have two civilization center with help WHO through MedGlobal. One of them in Kamal Adwan in North Gaza, Beit Lahia, and another in Gaza Patient Friend Association Hospital. Kamal Adwan, Dr. Hussam talk about it, and I will talk about Patient Friend Association Hospital in Gaza. We measurement children by MWAC to identify some severe malnutrition or moderate malnutrition, and treat them by providing RUTF, RUIF, and high energy biscuit. This is available until now. Three of these items are UTF, RUIF, and high energy biscuit, and this make a successful story actually, and you see, soon you will see it. Also, Patient Friend Association Hospital actually now replaced 3 hospital, pediatric hospital. It's destroyed about 7 October, beginning of the war. And now it's a stabilization about just pediatric. Sam, mom, with the project MedGlobal.
Rana, and I'm happy that we have three other members of our team inside Gaza joining us. Amir and Shafiq and Fatima will give you a chance to speak right after Rana. Rana, how are we getting these supplies? People ask all the time, do you have medical supplies? How are you getting these supplies?
Yeah, some medical supplies came from UNICEF about RUTF, RUIF, and high energy biscuit, and some we actually we received it about multivitamins for mother and children. Actually, these items until now.
So you receive them from UNICEF, which is a UN agencies, and also you receive medical
Yeah,
supplies from some of the border crossings that are still functioning, right?
yeah.
So tell us a little bit about the recent shipment that you received. I know that a couple of days ago you
Actually,
received, yeah.
last shipments not for 34 beds and ventilator, and that's help the patients. Actually, in some hospital here in North Gaza, Beit Lahia, Jabalia, and Gaza, some of patients lying in the floor and corridors because no place for them. And with these beds, will help to better lying better. Also about ventilator, as you know, saving life. Two ICUs in North Gaza, one of them in Indonesia hospital, and then the another in Kamal Adwan hospital. We have two ICUs, and this ventilator will help inside the ICUs, saving life and is to health team working and help patients to receive the better care. Actually, this helpful, very helpful, actually very helpful in North Gaza. We hope this medical supply to help health team worker and help patient to receive and deliver better care hospital.
Thank you, Rana. Jackson,
Welcome.
people who are not aware of the logistics and what does it take to get uh, a gift in kind and the procured medications, medical supplies, medical technology into Gaza, they cannot imagine the amount of paperwork and the hurdles that you go through with the inspections and everything else. Can you give us an idea about what does it take to send, let's say, this shipment of hospital beds from the US or other places, or from Egypt or from Jordan to Gaza? What do you have to go through?
If I was going to walk through every step that we had to go through to get a simple shipment like 34 hospital beds into Gaza, it would take the rest of the interview and beyond. The logistical challenges for this entire response are the silent impediment and hindrance that has made all organizations significantly less effective at responding on the ground. In no other response has MedGlobal had an issue where we can't get basic medical supplies, needles, gloves, IVs, oxygen concentrators into a region when this is what our team needs, this is what our team is asking for. In general, to get anything into Gaza, you need to first get it into either Jordan or Egypt. And then from there, you need to then negotiate with the authorities on the other side to get pre-clearance or pre-approval for most of these items to come in. This was such a complicated and really undeveloped process that it was actually MedGlobal that started to write the framework for how this works for most of the other organizations in this space. And today, there's two NGOs that work on what's called the pre-clearance process for the UN. It's the Norwegian Refugee Council and MedGlobal. And as a result, we've cleared millions, I think it was up to 6 million sensitive critical items, the vast majority of which have been health items, to ensure that they can get safely into Gaza to the teams on the ground who are doing the phenomenal work to make those useful. So it's not been easy, but we've really put our our heads down and finally gotten a system that has delivered some success to our wonderful team on the ground.
So I'm going to ask you about how many pallets of medical supplies or gift in kind that we were able to get into Gaza through either Rafah border crossing or Karam Abu Salim or Erez border crossing. But meanwhile, because we have Shafi and Amir and Fatima with us, and I don't know how long the internet will stay. Shafi, why don't you start? Shafi is Deputy Country Director. You are based in know where tell us about your position and what you are doing to serve the community, and what are the challenges that you are facing every day.
Yeah, hi everybody. It's nice to meet the MedGlobal team here, and really I appreciate your support in daily basis. Actually, due to the poor connection of the internet, I got some words from you, Dr. Zahir, about the main things and main challenges that we are facing in Gaza. As you all know, that the situation now is very terrible now. It's kind of things that is very bad going on the ground here. Evacuation and displaced people in daily basis moving from side to side, from area to area, looking for the more safety area and looking for their survival things from the shellings, from bombings, from destroying the houses over their heads. So you know that lots of needs raised from the community, mainly for the health in health sector regarding the spread of the diseases, spread of the lot of communicable diseases from the skin diseases, meningitis, respiratory distresses, lots of diseases here spread among the community, particularly among the people who are in the tents, because most of the people are living now in the tents, which mean that they are living very poor regarding the sanitation, hygienic, poor and very bad water supplies, no electricity, nothing available here to support the people. As a MedGlobal, we are trying hardly to reach for the most vulnerable and oppressed people here in Gaza. Particularly, we are talking in the south and middle because we are, you know, that's separated north from south and the middle. We are now have more than about 16 medical points scattered on south and middle areas. And we have also our nutrition stabilization center. We have our primary care center. We also have the UNICEF project for the screening children under 5 years. And maybe can Amir give more details about the achievements and the distributions of this site. The main challenges here also, you know, that the people here are looking for everything regarding the lack of and shortage of food supply, water supply, medications, facilities, and they have never things. We don't have anything now. All the people here are looking for everything. As much we can, we coordinate with the WHO, we coordinate with the UNICEF, we coordinate with other international organizations to and maximize our efforts to reach for those people, particularly for children and for mothers who are in need for such services in such hard conditions and hard circumstances. We try to reach for those people due to our scattered medical points, 60 medical points, and our primary healthcare center and our nutrition stabilization center. As much as we can. Really, we maximize our efforts regarding, despite all the, you know, shortage of facilities, shortage of things here available in our hands. We try to use our resources as much we can with our partners, with Ministry of Health. They support us in providing our medical points with some medications and some facilities as much they can, because most of the warehouses of the Ministry of Health now suffering from severe shortage in all these things, because we are in daily coordinate with them and asking them for this support, but they are also suffering. Also, UNICEF also they are suffering from lack of some materials regarding our UNICEF intervention or co-partner intervention for the children in under 5 years for screening. They have no photo sometimes, and the MOAC itself it's not available in their warehouses. So also all regarding the shortage and the suffering, it's not just for the local partners, it's for the international also. They are suffering from these things. And finally, we all of us know about the poliomyelitis, which is now there are 3 suspected cases here in Gaza. Suspected cases here in Gaza regarding the polio, and the WHO with Ministry of Health with the
I think we have Shafiq froze for now. Amir, are you able to speak? Or Fatma? Yeah, while we're trying to get the connection with our team in southern Gaza and middle area, Doctor, okay, it looks like we lost them all. Rana, I think one of the question is about the polio. There was one question about polio and polio vaccination. Are you aware of any campaign right now to vaccinate children for polio in Gaza? And
Actually, until now, no cases of polio cases. Just the solution now, awareness about clean, and now no clean support in North Gaza. And if you found it, the price very high. But until now, no cases about polio.
so there is no confirmed cases of
Yeah,
polio in Gaza.
yeah.
There are, I think, Shafiq mentioned there are 3 suspected cases. Polio virus was found in the sewage in Gaza,
Yeah, in
which
North
could be
Gaza,
related to that.
yeah, in North Gaza until now, no cases. But
Okay,
in South, yeah, you have,
southern.
yeah.
Okay, Dr. Muhammad, tell us about your role in Egypt. I mean, you're located in Egypt. What's your role within MedGlobal team? How can you help the situation in Gaza? And also, if you want to shed some light also about the 100,000+ Palestinians who fled Gaza to Egypt and they have no health services right now.
Yeah, thank you, Dr. Zahir. And I just want to say that for our Gaza team members, I have been working with them almost every day, and I am always in awe of what they do on the field every day. The amount of resilience, the amount of strength that they display every day, despite all the challenges that they go through, despite the security issues, despite the food issues, despite everything, they just keep going on and not looking back, just wanting to help people. So I just want to say thank you to Raja, Shafiq, Fatma, Rana, Amir, and everyone in Gaza. And we're really thankful for you with us every day. Regarding what we're doing and what I'm doing in Egypt in general, I am the emergency medical team coordinator, and part of like what you mentioned earlier of the response of MedGlobal in Gaza is sending emergency medical teams, full teams of medical health professionals to support the healthcare system in Gaza. As we have seen since October last year, the basic infrastructure of Gaza have been collapsing. Right now, there is about less than 16 hospitals out of 36 who's operational. There have been attacks, more than 500 attacks in health facilities. So the healthcare system in Gaza is completely collapsing, and it needs everyone to support it, whether in medical equipment and supplies, like Jackson mentioned and everyone mentioned, MedGlobal is doing, but also in health workforce. And that is what we are doing by sending emergency medical teams to Gaza. And that basically previously has been going through Egypt, since Egypt had an open border with Gaza, the Rafah border. But recently, due to the developing situation, the Rafah border has been closed, and the access to Gaza has been getting more difficult. It's now going through Jordan. It's now more difficult in terms of numbers, in terms of medical supplies. So it's been really a challenging issue for us to continue to provide the support for the healthcare system in Gaza. Part of the importance of the response of MedGlobal, of emergency medical team in Gaza, is that these doctors go and see the situation on the ground, away from the numbers and the articles. They go away from their safe working spaces, equipment, hospitals, to completely challenging situation. And then they come back and tell their stories and tell the personal story they see, and the amount of destruction and the amount of suffering that these people are going through. The other point that you mentioned also is the Palestinians in Egypt. Since October last year, a lot of people has been crossing Gaza to Egypt away from the consequences of war. This number has been exponentially increasing till it's reached about 130,000 Palestinians in Egypt. And those are unfortunately not covered by any large umbrella to cover their basic needs, their education needs, their health needs, their basic needs. They're not covered by any humanitarian organization because they are not considered as refugees like other refugees of other conflicts. So currently, there are a massive needs for these population here in Egypt for support to support their needs, especially the health needs that they currently require here in Egypt. And MedGlobal is continuously exploring this area and how to support these people inside Egypt and also in Gaza itself.
Thank you, Dr. Al-Dakruri. So we have Shafi, Fatima also. I'd like to hear from Fatima and Amir. I hope that she's able to come back. Shafi, you were cut off when you were talking about the 3 suspected cases of polio in southern Gaza. Tell us a little bit more about this, and what are the efforts now with the WHO to vaccinate children, if anything like that will be happening?
Yeah. Now the WHO, the UNICEF are trying to bring more about half a million vaccine to cover the mainly for children less than 8 years old, and there is also some campaign for health education for covered all the Gaza Strip also. They are working with the Ministry of Health, UNICEF, WHO to cover this campaign regarding also for notification about any case regarding the signs and symptoms who are maybe received in the medical points, received in the clinics here in Gaza Strip. So they are now working hardly. The campaign will start about 16th of this month, the 16th August. Regarding I think the vaccination or something like that for the campaigns raised by WHO, UNICEF, and the Ministry of Health. So till now, the effort is going hardly to control the situation on the ground, and also we are also working with our medical points to be in the same track with this campaign with the WHO, with the UNICEF also. And we reached our doctors and provide them with some application to register any suspected cases with some signs and symptoms that the WHO and UNICEF assigned these things. So all efforts will be moved to try to control this serious attack from this bad environmental and sanitary we are living in. So we hope that we can jump on and over all these things and try to resolve these things and control the situation before moving to another areas. So we hope that be controlled, and we will be in direct contact with all of you and update the MediGlobal team with everything on the ground. And we are in direct contact also with our medical team in on the ground.
Okay. Well, thank you, Shafi. I'm going to ask you a little bit about some of the hygiene stuff that you and Rana have mentioned. That this is a disease, polio, that is transmitted through food. If and also if you have poor hygiene conditions, then people can take it through the food, and then that can cause paralysis potentially. 1 out of 200 people who are affected by the virus can have paralysis, especially children, of course, if they are not vaccinated. So what are some of the hygiene problems that we have, and why is it that we are talking about polio right now in the 21st century in Gaza? But before that, Fatima and Amir, I'd like to hear from you. Fatima, last time we met in January, the situation actually was much better than now. And things were challenging. There was displacement. We were in Rafah. There were about 1 million people in Rafah area. Khan Yunis was under attack. Nasser Hospital was open. Other hospitals were open. Things have changed since then to the worst. Tell us about your daily life. You're a woman in Gaza. You are part of MediGlobal team. I think you work like 25 hours a day. You're always on the go, like every member of our team. Tell us, what do you do from the morning until you go to bed?
Hi everyone, thank you and thank you for all efforts about Palestinian people and make services about IDPs at Gaza Strip. Actually, when I speak about my life in Gaza before war and the situation here at the still escalation, a lot of things different about me. Because I evacuated from Gaza to South area, also now to middle area. The all lifestyle different about any woman at Gaza Strip. Because the escalation is continue about Palestinian people. Also, we are for my duties at MediGlobal work, we have many duties at the morning and still work more than 9 and 10 hours at our office and at the field in the ground. We are now MediGlobal successful and successfully to establish primary health care at the war. Medical point, we have 16 medical point now at Gaza Strip, South and Middle area. And this is need a lot of duties and a lot of efforts about us to follow up implementation this work at the ground. And the Gaza now under attack. Also, we work with our team here with dangerous condition. In my opinion, I see my family at the end of week once day because we have many duties at the work now. I want to speak about the mission with MediGlobal because MediGlobal successful with the 5 mission from Rafah to Gaza and see our team and medical team at Gaza here and make provide services, health services to Palestinian people. This is a good idea. And MediGlobal, maybe this is a great job with MediGlobal to increase the mission at Gaza Strip in this situation. This is for my side in this
So you're talking
time.
about the medical missions that we are sending, and that you think this is a good idea to continue sending medical missions to support our colleagues in Gaza.
Okay.
Yeah.
Because we have shortage about the health system at Gaza. You know, the health system destroyed in Gaza before the escalation, the siege. Is affected about Palestinian people and all health system. Also, these missions and health worker provider provide health services about Palestinian people and support the health system with Ministry of Health. You know, a lot of hospital at Gaza destroyed in this moment.
Amir, thank you very much for being with us and for your patience. I think everyone mentioned the medical points. People maybe in the US do not understand what is the medical point. I worked in one of them when I was in Gaza. So we have a clinic where it serves the people who are displaced from other places. It's run by local doctors and nurses who are part also of the displaced population. This clinic provides basic healthcare, primary healthcare, pediatric healthcare, wound care, mental health support, prenatal care to the women. And we have 16 clinics like this throughout Gaza. But in order to have a clinic, you need to have medicine, you need to have medical supplies. It looks like you are responsible for distribution. Tell us a little bit about the distribution of these medical supplies, these medicine to the clinics to make sure that they are serving the people and the patients every day.
Yeah, thank you, Dr. Zaher, for this engagement here in this live stream. When we mention the medical points, you know, we talk about healthcare services which are provided for the IDPs, provide essential healthcare services directly to the communities and the IDPs, including continuous follow-up of chronic diseases, for example, for the IDPs patients, and provide a rapid medical response to the IDPs to ensure the continuous access to essential medical service. But when we mention the medical aids or the medicines, we always ask by the people and the IDPs in the shelters, where is the medications? You know, we have a severe shortage of the medications which are provided for us from outside due to the siege and that the occupation cover us from all the sides, that there is no any supplies enter for Gaza Strip, and the storage of the MOH, the Ministry of Health here in Gaza. We ask them to provide the medications for us, and they say we are run out from this type of medications, especially the medication of the chronic patients who are the high priority right now, such as the hypertensive and diabetic patients, also the cancerous patients. In addition to or in lighting of the spread of multiple infections such as dermatosis, skin diseases, and a lot of cases who face like gastroenteritis, they always go to the clinics or the medical points. The doctors make prescriptions for them, but without any drug, because you know we have a shortage of the medicines here. And we want to talk about supplies, maybe about the nutrition supplies. We have a program with cooperation with the UNICEF. This program have a main activity as find and treat is a screening for the malnutrition children. We conduct a rapid nutritional assessment for the children under 5 years old, and these children who are the high priority in the society. this mission is to detect the cases with acute malnutrition and treat them. And this is the trendy issue in Gaza Strip and in these situations. We give them, or we give the children with the normal WAC preventive supplies, and it's run out from the storage of the MedGlobal storage and UNICEF, our cooperator here. We want to make a summary for this. We have a shortage, severe shortage of the medications and the medical aid or the supplies.
Thank you, Amir. I'm going to ask each one of you to tell us what is the secret for the determination and the resilience of the people of Gaza. And these are especially for Raja and Fatima and Amir and Rana. Tell us your secrets so we can use it here in the US and other places, because I haven't seen people like you in terms of the strength and the determination and the dignity despite of the circumstances. But before that, Rana, tell us, what do people eat in Gaza nowadays?
Actually, now just canned and bread. There is the
Can-
item. This item available. Yeah, no fruits, no vegetables, no fish, no chicken in North Gaza, but in the south, I think all of this found. Until now, just canned
in South
and
Gaza is better than North.
more available. Yeah, in south, yeah, it's found, but here in north, Beit Lahia, Jabalia, and Gaza, no.
Do you eat 3 meals a day?
What?
Do you eat 3 meals a day?
Yeah.
So, so food that are nutritional is not available in Gaza. In southern Gaza, Amir and Fatima, is the situation better in terms of access to food?
We have many items, but more expensive, more than another area.
Okay. So this issue of expensive, Raja, tell us how can we, or how are we getting money into Gaza, so to our doctors and nurses, so they can buy food, they can buy medicine, they can buy supplies for their families. Because people ask all the time, how are you getting money?
Yes, actually, we face many challenges related to money because there's no liquidity inside Gaza. So we figure out a solution for this issue. We actually, for 3 months, we didn't pay the salary for the healthcare providers because we face problems. But finally, we find an application. We contact the company inside West Bank, and actually we now download the application, ask the healthcare providers to download the application, and we send the money through this application through West Bank. So now we solved the problem, and Alhamdulillah, finally we are succeed to pay for the healthcare providers inside Gaza.
So this application called PalPay.
Balpay, yes, it's called Balpay through Jawal company working through Palestine or Gaza and West Bank. We download the application, and the company, Jawal company, pay for the people through the application, and they receive the money inside Gaza.
So explain that to me a little bit more, maybe Amir. So you have the application in your phone.
Yeah.
Let's say that we transferred to you $200. What do you do with this application that has now $200 on your account? You go to the bank and you
Okay.
get.
Can you hear me all right? Yeah, okay. About the Balpay, I thank you, Dr. Raja, for mentioning this Balpay application. Transfer of the money by the Balpay application, we receive the money here in the Balpay application. Then we go for, we can say it's exchange point for the money in the informal shelters. It's distributed in the shelters. So you go for a person who responsible for this. He take, we can say it's also challenging because the commission it's too high. You know, my friend or my colleague in this organization told me that he received the money. He like every $500, they take a commission about $175. So the commission too high, enlightening of the expensive of all the items here because of the efficiency of the items here. Okay, we have vegetables, we have fruits, but it's too expensive to buy it.
Okay,
So
so
application is also a challenge.
people charge you 35% for that exchange, but are you able to,
Yeah.
let's say you go to a place where you can, they don't use transactions with money, but they look at your application and charge you on your application itself? Are there places in Gaza where you can go to them and buy stuff without exchanging money? And maybe Raja can,
Sorry, Dr. Zahar, the network here is so bad, so I didn't hear
or
you
Rana.
well.
Actually, there's a persons inside Gaza, maybe 3 or 4 persons inside Gaza, located for this application. You can check the application and give, for example, the client for example, not the whole money or the whole amount, but they give him for 500 shekel or $100 only, and after 3 days the person need to return back to this person and take another amount. They didn't give them the whole amount of the salary. Maybe they can take the amount during 3 or 4 times because there's no liquidity inside Gaza.
How about banks? Are there bank branches in Gaza that are still open?
There's one in south, but in north there's no bank inside Gaza. I think we're facing this challenge or these challenges with Rana and Abdullah because there's no bank at Gaza itself, but we have one branch at the south area. And you know, this one bank serves for maybe more than 1 million person. So they close the doors and nobody can enter inside the bank. That just they can use the ATM machine. That's all, and not available all the time. So the situation inside Gaza related to the bank issues and money is really so challenges, especially for us as an organization working on the ground. We face challenges in that issue.
So we're coming to the end of this session. This is very informative, I think, to me and many people.
Yeah.
Jackson, would you like to add anything, Dr. Dakruri? And then I'm going to ask Rana and Raja to tell us the secret.
Well, I can touch briefly upon what I think the secret is, but I won't give it away. To me, before I came to MedGlobal, I always knew it as an international EMT organization, right? We send doctors and nurses to work in the most dangerous places in the world. So you can imagine my surprise when getting to Gaza with one of our missions to see the real scale of operations that Dr. Raja had already going on the ground. She has a team of 10 times as many doctors as we would ever bring in that have responded in every governorate in Gaza, from primary health to nutrition to maternal care. It really was astonishing to see how capable our local team is and how they will always work 10 times harder than any of us do on the outside. It speaks to not only how much I've seen them care for their community, but also how, we often think of the American doctors that go into war zones as the heroes, but it's really the local doctors and nurses who live it every day, like our MedGlobal team in Gaza, that have really shown me what it really means to be a hero, and I'm honored to be able to work with them in this capacity.
I mean, I totally agree, Jackson. I worked with doctors in Gaza that they lost many members of their families to the war, that they have their houses destroyed, that they are themselves displaced, and they live in tents. So in the morning, they go and bring water, clean water to their tent, to their family who are living in tents. Um, and it takes them maybe a couple of hours to bring clean water, and it's not an easy task. They get some bread, they come to the hospital to serve their patients with very limited supplies. Many times they have these mass casualty events because of the bombing. You have an influx of dozens of patients. Many of them are children, mutilated, bleeding, and they are on the floor of the emergency room. You don't know what to do with them. You don't have access to specialists. You don't have medical technology to take care of them. Many of them die on the spot. Many of them are dead on arrival. And they are themselves under threat because hospitals are targeted, and they continue to do it day after day. So this is the definition of resiliency. And I think these people deserve our respect, attention, and support. Um, I leave the final comments to you, Rana and Raja. Tell us about what goes in your mind day after day. What's the secret of determination and resiliency in Gaza?
Yeah, actually, I will start about the secret. Maybe it's magic secret, which is belief. Actually, I'm believe of my people, believe of our right to live in freedom, and believe in that the Palestinian people have the right to live freedom, to have health care, to defense on their dreams. We have dreams, we have life. We are not numbers, we are a human being, and we love life. So my message for the whole world, we need ceasefire and we need to live in peace. We are love life and we have dreams. And I think this is the secret of our resilience here in Gaza.
Thank
That's
you,
all.
Raja. Rana? Rana left us. Amir, Shafi, Fatima, if you want to tell us anything so we can end this session that goes in your mind. I think we lost them also. Dr. Al Dakruri, why don't you give us the last few words in this session?
Yeah, I just want to echo what Jackson and Raja mentioned. I am always impressed by the resourcefulness and the professionalism of people in Gaza. As a doctor, I am always amazed on how they can adapt to the situation that they put in. So, for example, we are hearing stories from doctors on the field that they were using vinegar to treat the wounds because there is no available antiseptics. I am just always amazed by their efforts, especially people from the local team who are a part of the population that is going through this situation, but are still going to work every day with that attitude of wanting to help. So I can just say thank you to everyone, and please keep doing what you're doing, and don't let your spirit break.
Right now, we'll leave it to you to give us the last words.
Actually, on this earth, and in this earth, there was deserve life. We deserve education. We deserve everything good here. I love my Gaza. I love people. I love you all. Actually, I'm happy to be in Gaza and happy to death in Gaza.
Hopefully, we can meet together in Gaza and we focus on the rebuilding. And maybe the next
Inshallah.
session we'll talk about the rebuilding of the healthcare system and the rebuilding of Gaza, because we have very high hope for recovery and rebuilding in Gaza because of the determination of people like you, Rana, Raja, Amir, Shafi, and Dr. Hussam, and everyone else inside Gaza. Thank you very much for this, and hopefully we can meet soon. Take care.
Thank you.
Goodbye.
Thank you. Bye
Thank
bye.
you, everyone. Thank you.
Bye
Take
bye.
care.